Our beautiful outdoors offer endless opportunities for adventure, but there's a growing danger in the woods. Lyme disease is the most important tick-borne disease in North America today. What is it and how are we at risk? Ticks thrive in environments with suitable vegetation and humidity, often along hiking trails. They do not actively hunt for hosts, but engage in a behavior known as questing, where they climb to the top of grass blades or leaves and grab onto anyone that brushes by them. Identifying the type of tick is crucial, as not all ticks transmit Lyme disease. In North America, the main types of ticks found on dogs and humans are American dog tick and the deer tick. To differentiate, look at the plate behind the head. If it is multicolored, it is the American dog tick. If it is all dark brown with long mouth parts, it is the deer tick. Only the deer tick transmits Lyme disease. Lyme disease is not actually caused by the ticks themselves, but by a bacteria called Borrelia burgdorferi. These bacteria cause infection when a host is bitten by an infected deer tick. The ticks and the bacteria they carry go through a seasonal life cycle, being more active in the spring and fall seasons. Adult ticks feed on humans or animals and use this blood meal to lay their eggs. The larvae then hatch and feed on small wildlife, then go through two molting stages, from nymphs to adults. Adult ticks are the ones we usually find on pets and humans, completing the life cycle. Early symptoms of Lyme disease include fever, headache, fatigue, and a characteristic skin rash called erythema migrans at the site of the tick bite, developing 7 to 14 days after tick feeds. If you experience these symptoms after a tick bite, seek medical attention immediately. If untreated, the infection can spread to joints, the heart, and the nervous system, causing more severe symptoms. In dogs, symptoms include fever, loss of appetite, reduced energy, and swelling of joints. So the next time you're outdoors and find a tick on you, try to identify if it's a dog tick or a deer tick. Then assess your risk exposure. If the tick is not engorged, it hasn't fed much yet, which is relevant when considering the risk of acquiring Lyme disease. Remove the tick promptly with fine tip tweezers, grasping it as close to the skin surface as possible and pulling upwards with steady, even pressure. Visit a physician or a vet if you need assistance. The tick can then be stored and sent to further identification and diagnostic testing. To minimize the risk of tick exposure in Lyme disease, stick to well-trodden paths and avoid tall grass and dense vegetation. Use tick control products for pets such as topical solutions, oral medications, and collars. Vaccines for Lyme disease are also available for dogs. Wear long sleeves, long pants, tuck your pants into your socks, and apply insect repelling on exposed skin and clothing. After spending time outdoors, thoroughly check your body and your pets for ticks, paying special attention to hidden areas like the scalp, armpit, and groin. Understanding the environmental factors influencing the spread of Lyme disease helps us determine when we are at risk. By staying informed and taking preventative measures, we can enjoy the outdoors while minimizing the risk of Lyme disease for both humans and companion animals.